do for going to the county and get pictures down there. I think, I don't know if you or who went. No, the drive-through at the tax office.
Oh, yeah.
You know, yeah. And because we're just trying to get people to, yeah. Well, I told them. Yeah. No, I told them. I said, let her do what she needs, because we got to get the word out. So, we want people to be able to use it. Doing it, I'm always trying to think of things that are going to make this easier for people. Right. Right. Yeah, because some people want that. That's
Mic check. We're good? Okay.
Okay, it's 11 o'clock and we're going to go ahead and get started. Good morning, everybody. I appreciate everyone coming for our press conference today. We have our area county judges that are here. Jeff Brannick from Jefferson County, John Gauthier from Orange County, Mark Allen from Jasper County, and Wayne McDaniel from Hardin County. So we're going to start off with Judge Brannick.
Well, good morning, and I appreciate all of you being here this morning. The last several weeks have been marked by sometimes confusing and sometimes contradictory information about vaccines and what local health departments, emergency management offices, units of local government are doing in connection with attempts to facilitate the most expeditious administration of the vaccine to our local populations. Those messages have confused in many times the elderly who first need the vaccine, those in groups 1A and 1B, those over 65, and those with underlying health conditions. In many cases, those individuals that are elderly do not have access to technology, computers, and so forth, and so you know, we discussed those issues initially to try to create a common cause. The Jefferson County Office of Emergency Management reached out to area emergency management providers, health departments, the counties, individual private healthcare groups, and attempted to facilitate what we think is a plan that will enable us to be in the best position to get the vaccines that we need to serve our citizens as quickly as we possibly can. Now, there are some promising things that have happened in the last couple of weeks with regard to vaccine or infection spread and so forth, with regard to fatalities. I'm going to leave that to my fellow county judges to discuss, but I would just mention that you know, we have come up with a plan that includes City of Beaumont and City of Port Arthur public health departments, Hardin, Orange, Jasper, and Newton counties. Private health care providers like Riceland are willing to partner with other private health care providers to the extent that we can get the vaccines distributed in a more efficacious fashion. And we're going to continue to work on that. We have submitted a plan of our group, and then I'll welcome Mayor Ames, who just arrived. We felt that the best way for us to have the best opportunity to get allocations from the expert vaccine allocation panel was for us to band together. We have submitted a plan to the state, which includes those health departments, emergency management departments, city public health departments, and counties and private health care providers that I mentioned earlier. And we have gotten the consent of each of those members of the consortium to distribute a certain number of vaccines per day, which we have previously put out on a press release that underscores our determination to move forward as quickly as possible. One of the problems that we've had that I think will be highlighted is that we want Texas to get per capita distribution of vaccines that's commensurate with our population. But the reality of the situation is that we now have two vaccine providers, Moderna and Pfizer. Each of those require 2 doses. I believe Pfizer 21 days in the aftermath of the first vaccination, and Moderna 28 days in the aftermath of the first vaccination. And so we are hopeful that Johnson & Johnson will receive an emergency use authorization very soon, and that new vaccine supplies will arrive on the scene so that we can bolster the number of vaccines that we distribute through the Southeast Texas region. We have requested 22,000 vaccines from the state, dosage of vaccines, because we have commitments from all of our partners here that we can do 11,000 doses a week. We received an initial tranche of 1,950 doses, which are in the process of being administered. We believe that this morning we received another tranche of 1,950 doses, which will be set aside for the second dose for those who receive it during the first round. We believe that the successful implementation of being selected as a hub provider by the state is contingent on our having this consortium that can work together and agree to do it in an area that has a larger population than Jefferson County alone. It places us in a good position to compete with those larger counties across the state that in the last few weeks may have gotten larger distributions. And of course, I know that on the state level, from having had numerous conversations with Austin, that the state is fighting for Health and Human Services to be more equitable in their distributions to the states based on their populations. So our agreement is that Jefferson County will receive vaccines with Lamar University in their new Science and Technology building, storing this in their freezers for us, for the consortium. Pickup and delivery is going to be accompanied by security and transferred using our Texas Vaccine Allocation and Ordering System, which has been set up. Each individual entity that administers the vaccine, whether it be the counties, Beaumont or Port Arthur Public Health, or private health care providers, will be responsible for inputting the vaccines for the individuals into the state MTRACT and TDM systems daily, the Texas Division of Emergency Management. All locations are going to operate according to their own standard operating procedures. Each of the entities, like the City of Beaumont, City of Port Arthur, have had their mass vaccination plans in place through our incident action plans and emergency plans for a considerable period of time, but those have had to be dusted off and put into action during an unprecedented time in our history. There is a new website called vaccine.beaumonttexas.gov that is for online registration for the virus, for the vaccine. Now, one of the things that I want to stress as we move forward, particularly at a time whenever we have limited amounts of vaccine to administer, is please, if you're under age 65 and you don't have underlying health conditions, please don't go register as of yet. There will be time for people to register whenever we have sufficient vaccines to take care of those over 65 and those with underlying health conditions. Those are the individuals that we're most concerned with right now. Additionally, for those people that do not have access or do not know how to efficiently work a personal computer or online registrations, there is a centralized phone number. It is 409-550-2536. As for those people who can't access the website, it's gone active today. It'll be available on Monday through Friday from 8 a.m. to 5 p.m. I'm going to ask that the public be patient as they attempt to access that, because I'm sure there's going to be a number of people calling at one time. There are only a certain number of individuals that are available to answer the phones and a certain number of lines. So it's possible that you'll get a busy signal or some other kind of message that please be patient, continue to call back. I hope that you won't get too frustrated. It's our aim that people can do this as easily as possible and that we're able to accommodate those individuals that don't have access to technology in our community. The registration will be done, but the scheduling will not be done until such time as we know that we have sufficient access to vaccines to accommodate the demand that is out there. And at this time, again, vaccines are only going to be available for those people in categories 1A and 1B. If you register and get an appointment and it turns out that you don't fit within one of those categories, you're going to be turned away. So we want to protect our most vulnerable populations at this point in time with a very scarce resource. There have been reports on the news that seem to indicate that, getting the vaccine in sufficient quantities to vaccinate everybody, all 254,000 people in Jefferson County and in the couple of 100,000 people in our adjoining counties, is just a matter of making a phone call, and that's not the case. If the manufacturers make 1 million doses a day, it's still going to be a year before all the people in the United States can be vaccinated. It's going to be a very slow, plodding, methodical process until such time as we have more supply chain, until Moderna and Pfizer can make more doses per day, or until Johnson & Johnson joins in the fray and is able to add to that supply chain so that we can get those out more efficiently and more quickly. So I am going at this time to ask for comments from Judge Allen, Judge McDaniel, and Judge Gauthier, and then allow Mayor Ames to say anything she wants to say, and then we'll take questions for anyone who has any concerns or thinks that there's something that we have not covered that the public needs to know. Thank you. Judge Allen?
I was really hoping I'd get to go last. I'm Mark Allen, County Judge in Jasper County, and basically just to kind of put everything into context what Judge Brannick said, we got help coming. We're trying. I don't think there's a soul in this room or probably in this building or on this block that doesn't know somebody who not only had COVID-19 but probably was admitted into the hospital for a long duration or lost their lives to it. And every single family affected by it knows how serious it is, and we should all continuously remind ourselves of that. We've lost friends, relatives, people have lost their entire savings just to try to combat this. And so we've got to do what we can. We've got to keep them in our prayers and keep moving forward. Now, we do have some good news. Around January 12th, statewide, it looks like we've peaked. And you'll probably notice in all the numbers throughout the jurisdictions in the region that the numbers have begun to slowly dwindle down. It looks like hospitalizations have dropped close to 1,000 statewide. ICU beds have dropped by over 200, and we're slowly making progress. Here in Jefferson County, which I know Jasper County and all of the other county judges watch very closely, the ICU beds are still around. I think you still have 2 open. That's important to us because not only for our patients or our citizens who have COVID-19 who are in critical need of care, but also heart attack, stroke, car wreck, any other kind of accident, they are our lifeline. And so we all have to work together to ensure that we protect Jefferson County as well and these hospitals that keep our people alive whenever they need help. And Judge, I appreciate what you do in your leadership and your health department and your hospitals for what you do to protect our people. I'm not going to take too much longer on it, but we are working toward a decline. I will say that Jasper County is right now about 87 active cases, which is tremendously better than where we were just a few weeks ago. However, thus far I've lost 50 lives in my county, some of them friends. To me, that's unacceptable, and we need to do everything we can to keep those numbers from growing even by one other person. And we got all of our health professionals here that are fighting tooth and nail to try to prevent that. So I thank you. I thank you for your time. God bless each and every one of you for what you do and for getting the word out. Judge?
Next, I'd ask Judge McDaniel to come up. I would notice that even there's some rather esoteric work going on, that even over in Houston, Harris County, they are actually sampling the sewers for the incidence of COVID infections in the sewers. And over the last several weeks, that number has come down pretty significantly. There's a lot of information that's out there that indicates we're on the backside of the infection graph. We're hopeful that that will continue. We certainly are going to ask everyone to continue to practice good personal hygiene, to maintain social distancing, to wear their mask when they're out shopping and so forth. But we're rather hopeful about what we're seeing as we move forward, and hope that that trend continues. Judge McDaniel?
Good morning. First of all, I want to thank Judge Brannick and my other fellow county judges, and also Mayor Ames, and all of the other city and county officials who have decided to come together once again. I think we demonstrated back last spring that we're stronger together, and we're going to prove that again this time. Being able to come together and work together and pool our resources, which again is our experienced healthcare or public health rather, and the emergency management partners working together to help the citizens is going to prove beneficial. At least we all think so, and I think we'll prove that to you here in the coming weeks. Just going to talk briefly about where we've been statewide on vaccines. Texas continues to be doing reasonably well as compared to other states with regards to vaccination of COVID-19 with our citizens. However, over the past couple of weeks, or I guess over the past several weeks, HHS has consistently been sending Texas less than its fair share on a per capita basis. We feel like in the coming weeks that's going to improve each week as we move along. And again, I just want to thank Judge Brannick for bringing us all together and forming this consortium to do a better job on vaccines. I think that we will now begin to see more vaccine coming into Southeast Texas. And we have already demonstrated, in my opinion, that we can get it out into the arms of Texans, and we're going to continue doing that. In Hardin County, we have had an email address where somebody can send an email with your information to register. Anybody that has done that prior to today, you do not have to re-register. We have your information, and we will get you into the system. But after today, please use the website that Judge Brannick mentioned earlier, which is vaccine.beaumonttexas.gov to register. And I want to thank the City of Beaumont for hosting that service for all of the consortium here today. Thank you.
Well, I also would like to thank Judge Brannick and all the other judges as well. I mean, anytime that it's rare that you see government get to work together as well as this group does here, and I'm very appreciative of that, that we're able to do that here. And it's because it's important for our citizens. We all live next to each other, and most every one of us has families that live within these same counties, and so it's good that we're able to do that. My portion of the meeting today is I guess probably what I would call one of the most sobering parts of it, and it's our fatality rate. You know, one of the things, and we wanted to talk about that, is that the state of Texas as a whole ranks very well. We're number 28 that in our fatality rate here. So I think that as a state we're managing it well, but not nearly well enough. You know, the idea is to get to a 0 fatality rate from COVID. We're not there yet. I'll echo Judge Allen's sentiments that I've had several friends, multiple people that we know, that I know personally, that have succumbed to this, and we want to eliminate that. As a state, we had hit a peak of 316 fatalities. We're at an average of about 268 right now. What we're seeing different from now to last summer, when we actually had a peak of 278, was a very short period of time, but it seems to be lasting a little bit longer, and that rate is staying higher for a greater number of days. The state as a whole will probably see this year, we're estimating about probably 20% more deaths in 2020 than we saw in 2019. And so we know that that's, you know, directly impacted to the COVID-19. So we want to make sure that we're moving forward as best we can. I think we have a good plan moving forward based off of the availability of these vaccines to be able to start bringing that number back down. As a state, that out of the rest of the states, I think we are doing well, but we got a long way to go. But I think the reason that we wanted to talk about the death rate is to reiterate the fact of how important it is still today to wear your mask, to continue to wash your hands, to continue to do hygiene like you're supposed to do, because that's what we're going to get. We've still got a long way to go. To Judge Brannick's point, we've got a long way to go before we're going to have everybody vaccinated. So it's not over yet. We still have to keep all the safety measures in place. We have to keep those in mind every single day while we're out and about and moving around, and that we want to do it. Even when you get your vaccine, it is still important that you wear your mask and that you continue hygiene, because the majority of the people, if they see you without a mask, they're not going to know whether you've had a vaccine or not. So let's continue to wear those. Let's continue to keep safety priority so that we can bring these numbers back down. And again, I think that's it. And thank you, Judge Brannick.
For an individual who had registered to get the vaccine or wants to get the vaccine and has been unable to do so thus far, I know that it can be frustrating. I would just point out that so far, the state of Texas, despite having received less than its equitable allocation of the vaccines, had vaccinated over 3 million people. That's second best in the United States, behind only California. So despite having received fewer vaccines, we vaccinated more people than all the other states except California. And I think that's a testament to our public health departments and our private health care providers and our emergency management departments working together to identify and expedite the administration of this vaccine. So right now I want to call up Mayor Ames and allow her an opportunity to visit with you.
Thank you, Judge, and thanks for the rest of the elected officials and the judges for being here. We have very much realized that we work very closely together, and the better we work together, the better outcome that we will have, and I think we've proven that. So all I wanted to say is, because everything else has pretty much been said, but just to reiterate the fact, I see people all over town close together, shopping, etc., without your mask on. Please wear your mask. Please social distance. Please do what you can to follow the CDC guidelines. This is so important. Like was said earlier, we all know someone who has died from COVID-19 and have suffered severely, and those families are affected drastically. We have a lot of individuals within our public health departments, within our elected officials, and with our emergency management teams working to ensure that we get our fair share of the vaccines. We will try anything, even setting up a building to say we're ready. I just hope that it works out, and we are hearing that. I'm happy to hear, Judge, that y'all got another $19.50 for your next week's allocation, because for a while it was short in coming, and we're hoping, we've ordered some too, and we're hoping that those come in soon. But the only thing that I wanted to say is, when you hear about the locations where the vaccines are being administered, whether it be in Beaumont, Port Arthur, anywhere mid-county, please just don't go there without an appointment. That will cause a lot of confusion and take time that those individuals don't have. We have experienced people coming up to our health department and to our civic center wanting to get a vaccine because they're seeing that in the media. But once you register online, or you call and you register, you will get a phone call with an appointment. So if you just show up, it's not going to do any good, and all it will do is clog the system. So would ask that everyone just please try to be patient. We're working through this as fast as we possibly can. And those of you who choose not to take the vaccine, please read about it a little more and trust the science. That's all I have. Thank you so much.
And I just mentioned again, since Judge Gauthier brought up the fatality rate, that Texas is, deaths are always going to be extremely sad occurrences, and something that we want to work as hard as we can to prevent. And we're very thankful for our healthcare system for the dedication that they've shown over these last 10 and a half months in treating our citizens and working many long hours. But out of the 50 states, Texas fatality rate is the 28th lowest. Out of the 10 largest states, we're 8th lowest. So only North Carolina and California have lower fatality rates than Texas. So that's some small glimmer of silver that we can be thankful for. And we know that that's due to the dedication and professionalism of our medical professionals that have been so devoted to taking care of those individuals who have become infected with the disease. But of course, we want to reduce the spread of the virus. We want people to cooperate and care for their fellow human being, and in trying to continue this downward trend that we've seen over the last couple of weeks. So we're going to take a moment as we express our appreciation to our healthcare partners to answer any questions. And if y'all have any questions, you can direct them to anybody who's spoken. Yes, sir.
I'm Dave Rogers with the County Record in Orange.
Yes, sir.
And one of the issues that I've had in trying to cover this thing is the use of some numbers from the state website, the DSHS dashboard. And then the account numbers I get from Orange County, which tells me they're coming from Hardin County and providers. And they've only had like a handful of deaths in the last 3 or 4 months reported. Ms. Whitley in Hardin said something to me about this are not reported by where the person lives, but where the death certificate was written. And obviously the state has got showing 40 or 50 more deaths than Orange County's reported. So do y'all have some kind of standard for reporting that everybody can be apples and apples?
Yeah, I think that there have been some issues that we've worked on for a number of months. And of course, I want Judge McDaniel and Judge Gauthier to be able to weigh on this, that you're referring to their counties. But there have, you can expect some confusion. Number one, because Jefferson County is the home to most of the major medical health care providers. And so we have people coming from a lot of surrounding counties to get their health care. Sometimes those deaths might be reported as Jefferson County deaths, and subsequently on the death certificates when they go to the state, they may be referred back to their county of residence. We've had some problems with the accuracy of reporting on the Southeast Texas Regional Advisory County numbers, because those numbers on daily hospitalizations and number of patients with COVID in ICU are dependent upon reporting by the individual hospitals that house those patients. And whenever a hospital does not report, then the numbers are inaccurate. And so we try to look at the Department of State Health Services numbers. They receive input from TDM, and there's been some issues that they're working to resolve that deal with how Department of State Healthcare, Department of State Health Services and TDM numbers get information from MTRAC, the vaccine registration system, and those bugs are being worked out. But I can just say this, is that we work with human institutions. We're confronted with an epidemic the likes of which we've never seen during our lifetime. There are a lot of people in Austin, within our state agencies and our local public health departments, and that are working extremely hard to try to respond to this in the best way that they possibly can, given the limitations that we have in technology and cross-reporting of information to various websites and so forth. And those will be worked out. But I'm sorry for the confusion that it's caused you, because it's caused me some confusion too over the last several months.
Judge, when you talked about patient numbers, do you have any idea when these vaccines will be coming in, or is it like looking into a crystal ball?
It is like looking into a crystal ball, but I think, looking back at March, we couldn't get PPE, we couldn't get testing media, we couldn't get gloves or hand sanitizer. And over the course of a month or two, that started to open up. The floodgates kind of opened up. We were able to provide our citizens and our first responders and healthcare workers with what they needed to adequately respond to it. And I think as the supply chain grows, other vaccine manufacturers are added to the mix, that, we'll start to see over a couple of month period more access to the vaccines and more ability for people to register more quickly to get seen more quickly, to be vaccinated more quickly. That's certainly my hope and my prayer as we move forward. But Judge Gauthier, Judge McDaniel, anything y'all wanted to respond to this individual?
No, I did have just one thing, because, and you said it, is that there's multiple places that this information is coming to. And one thing that we don't want to do, just because I know that someone personally passed away in one county, I don't want to put them on that list, because they could be on a list already as reported as a death somewhere else. And then now we're making our increase of our numbers, that death rate, daily death rate go up wrong. It would be inaccurate. So until we can get those databases correct, where they're tracking each other and they're working on it every day, we're not going to pull those numbers over just because we know they exist. We don't want to do duplication. We're trying to eliminate the duplication. So we're going to make sure that those doing in our health departments are working with the state, with all the reporting systems, to make sure that that is reported correctly. So when we move it over, it moves correctly.
And we have to view all the data, not in a vacuum, but globally, because, it's just like when we've had increases in the incidence of testing for COVID-19, we've seen increases in the number of cases, and so are there more cases out there than what there were before the testing? No, that's just, we're identifying those. And so that's what we need to focus on, is the data is a tool. I agree with you wholeheartedly that the data is a better tool when it's accurate and we can depend upon it. But those issues have been identified, and I know that DSHS and TDM are working on those issues to try to rectify the situation so that you'll be able to depend on it in the future.
Okay, another question I have is regarding priorities. According to DISH's and the list that they have on their website, the priorities do not include policemen, firemen, or school teachers. But if you get a list that the judge sent me a couple months ago, they were at the top of the list, ahead of the 65 and over. When I asked the state, why don't you include the policemen, firemen, and school teachers, their explanation was that they follow the 65 and over guidelines, that they follow the people who have health problem guidelines, will take care of a lot of those groups. Plus, they'll have fewer sick people to come into contact with daily, because the elderly will have gotten their vaccines. But that doesn't appear to be how the order that's going in, because I keep hearing about police departments on a waiting list, sheriff departments from Jefferson County getting shots in Chambers County.
Yeah, it hasn't formally been on the list, and we've got requests in for information about that. I will tell you that at Jefferson County, for the limited number of doses that we're getting, our correctional officers are going to be on that list, because we have had such spread among, within our jail population. And we want to stop that spread, and so we're identifying that as something that we want to hit first, along with the elderly and healthcare workers. So.
Yeah, I think they said, people who daily work with COVID people. But I would say that I'm a newspaper reporter, and I probably deal with as many people out in the community when I'm newspaper reporting as do the sheriff or the deputy sheriffs, that are just out running around hitting their saddle.
Yeah, we could have a really long conversation about what's fair and equitable, and everybody would have a different viewpoint. I can appreciate that.
Yeah, well, and I would also, I don't mean to interrupt, Doug, but I would also like to add to your point that, look, when someone is infected or just exposed to it, and they get quarantined, well, anybody in their immediate vicinity that they've been with over the last 24 hours, 36 hours, is going to be quarantined as well. Our sheriff's department, our police department don't have so many people on shift. Well, if I lose a complete shift, then who protects our people? So that's why they're on the list. They're on the list is that I need my fire departments to be able to respond. And the only way our fire departments can respond is if they're out there working and they're not at home quarantined. So that's why they're on the list. And then that's why we've made that decision to move those people up, because they're very important to us being able to continue to protect our people in the other ways that we're supposed to protect our people. We got to protect them from COVID. We also got to protect them from other daily
My
activities.
situation is I don't have a preference. I think school teachers ought to be at the top of the list. They're trying
Thank you, Judge.
So it's a lot easier to determine how many people are in a police department, how many people are in a fire department than it is how many 65 and older people do we have in Southeast Texas. What metrics are y'all using to determine at what point you think we've gotten all of the people in 1A and 1B that would want the vaccine and then moving forward?
I think it's gonna, online registrations and call center volumes are gonna tell us whenever we've reached the saturation point with those over 65 and those with underlying health conditions that are above the age of 16.
There's been recent reports of vaccine scams. Essentially, folks are calling saying, hey, if you pay me X amount of money, I can put you on a waiting list and you can skip ahead. And essentially, the scammers are taking folks' money and skipping out on their promise. So my question to you is, how important is it for the public to know how this process works and what's going on so they won't fall victim to being scammed?
Yeah, I think it's important that we put out to everybody in the community that no one will be getting charged for this vaccine. So if somebody asks for anything of value in exchange for getting the vaccine, they're a scammer. Because the vaccine is going to be disseminated free of charge, and any reimbursements that we get for our healthcare workers and so forth are going to come through the federal government. But we will never ask an individual to whom a vaccine is going to be administered for anything of value. Money, personal information other than what we need to put them in the M-Track system. You know, so if there's people making those calls, hang up on them. Yes, ma'am.
I know last week was a very frustrating week for Beaumont as far as experiencing several delays. Are we anticipating any delays this week for the vaccines arriving?
Actually, it arrived early this week. Normally, we get a tracking number. We saw on the system that we were scheduled to get an allocation of 1,950 doses. Then as of Friday and Saturday, as we were looking at it, we said, well, we're not going to get it because we didn't get a tracking number. And that's always a prerequisite to actual shipment of the vaccine. But it arrived this morning, so I'm not going to complain about it. I'm just going to say thank you, and you know, we're hopeful that you know, there are over 3,000 counties in the United States, 254 in Texas alone, and so there are a lot of people that are vying for the vaccine. A lot of people that wanted the vaccine yesterday, but you know, I think we have to look at the realities of the situation we're in and view it much like we did, like I said earlier, back in March, where we had constrained supply initially and then it opened up. And I believe we're going to get there. But it's not going to be as fast as a lot of people want. A lot of my friends that have called me that are, you know, in their 70s and 80s that are wanting it, and I'm having to give them the same message. I want them to all get it. I want to get it at some point, but it'll be when we get to past Category 1B. Anyone else?
In November, December, we heard estimations that we might possibly reach artificial herd immunity by summer, fall. What kind of timeline are we looking at for Jefferson County as far as when we think we might be able to get these 22,000 vaccines, when we think we might open it, and when we, is there any hopeful timeline?
Yeah, I think that there's going to be an interface between herd immunity, vaccine distribution, and you know, I was trying to access it's an IHME report this morning, which I couldn't get the link to come up, but they're seeing some signs of a declining rate right now because of some small impact of herd immunity, which has not taken fully hold yet, but with the wider distribution of the vaccines, with improvements in the supply chain, with these consortiums and collaborations that we have with healthcare and public health and emergency management and county health departments, you know, we're going to distribute every dose we get as quickly as we reasonably can, and you know, it's going to improve our resistance to the disease with every individual that we vaccinate. And that's why we're so interested in working together to leverage our collective power to do the best job that can be done for the citizens of Southeast Texas.
I know in some cases, people who are able to get the vaccine are sort of skeptical and decide to pass up on their opportunity to get it, and so that in turn gives the opportunity to someone else who might be eligible to get it. But how important is it that those people who are skeptical and pass out, you know, give their opportunity away to someone else? How important is it for that person to think it over again and actually get it?
Well, if they're above the age of 65 or have underlying health conditions, you know, I think it's really important that they consider the risk that they're taking by passing up the opportunity to get what they say is a 97% protection from contraction of the disease. But at the end of the day, and it's not like 1797 or other periods in our history where vaccines have been mandated, and it is, at the end of the day, an individual decision. And I, for one, will not intrude upon that individual decision-making process, because we have a large enough number of people who want the vaccine that we're going to be able to distribute every bit we have. And that's what we're going to work forward. We're going to move forward on, and that's working with people who want it, because we can't even meet that demand right now. And that's what we're working toward, is being able to meet that demand. All right. Well, I thank y'all so much for showing up here today. I appreciate the opportunity for us to have some clear and concise information go to the public, and hopefully we've eliminated some confusion, and hopefully y'all will take that information about the vaccine.beaumonttexas.gov and the 409-550-2536 phone number and disseminate that to your readerships and viewerships, and again, please be patient on the phones. So thank y'all so much.